Hey, this is Different Careers with Kate Nudd. You probably won't see my face. Who knows, maybe one day my career will change where I don't have it to be a licensed massage therapist, but who knows? So just wanted to inform everyone I am out of a job. So if there is a spa in the Rochester, New York area, and you are hiring, feel free to contact me because I need work. So to forewarn you, part of the problems that were going on with work is I wasn't getting paid a legitimate wage. So if I get paid a legitimate wage, I try to go the extra mile, and I don't always end the massages on time. I do need 15 minutes in between clients, and I need to get paid for those 15 minutes. It'd be nice to get a salary. But if you're in the Rochester, New York area and you want to contact me for like an interview or something, also, other problems at work is clients didn't seem to understand sometimes how to get underneath the sheet properly. Even though I tried to explain things correctly to them, I only understand how to speak and read English. This is the language that I speak. That is it. I do not know Spanish. I do not know French. I do not know Hebrew. I do not know Greek. I do not know Mandarin Chinese. I do not know any other languages. So sometimes people came in and they acted like they didn't know English. So if that is a problem for you, then I don't know what to tell you, because I thought we lived in the United States of America where everyone's supposed to speak English and fluently. So, that is a side note, but I do my best for every massage, and I try to be relaxing. One of the things that I do need massage therapy clients to keep the massage focused. So a lot of times people come in and they ask me how I'm doing, and that to me shifts the massage to like, let's talk about the therapist. Well, you're here to get a massage. So unless people spell out to me the rules of what is okay to talk about, what is not, then I don't know how to have a conversation, because I get in trouble for talking too much, not knowing how to read people's mind and give them what they want, because I don't know what is okay to talk about and what is not. So that is a disclaimer. I do need a job. So if you're in the Rochester, New York area, feel free to contact me. So let's get into this introduction to Ashiatsu review. So in the meanwhile, I will be continuing to review classes because my license renewal is up at the end of June. So introduction. So it was Ruthie Hardy again, and she's going to show how to do some techniques on the bars. So let's see. Okay, are you ready to start thinking differently about the way you perform deep tissue massage techniques? This introduction to Ashiatsu deep feet bar therapy includes flowing demonstrations of Ashiatsu in Ashitai techniques delivered with the feet while standing and using overhead parallel bars. Learn more concepts, foot care, and take an in-depth look at specific techniques with a client in prone, supine, and sidelining positions. The foundational knowledge you gain from this course will help you determine if you have an interest in pursuing additional training in this unique modality. So unfortunately, I let a few days pass before giving this review, so I don't remember everything to a T. So I might actually have to refer to some massage therapy notes. So forgive me if this one takes a little longer. So let us get into it Is it around here? I don't know. Okay, so let us
connect and engage. Engage will help get into some of the detailed and focused work. And our third connect is connect and activate. In activation, we'll be having our clients move a limb and create space in the area we're working. We are also going to want to make sure that we use good feedback and clear and continual communication. So I'm going to set myself up and get in the proper position to start our 3 connects on the serratus anterior. What I'm going to have my client do is reach his hand over his head and rest his arm on his head. I'm going to bring the arch of my foot to just below the serratus anterior and compress, hold, and release. Changing my placement, connecting to a new portion of the serratus anterior, and compress slowly and release. Working all the way through that serratus anterior, compressing, 3, 2, and 1. We're going to feather off, and now we're going to engage. When we engage, we connect first, and then we're going to take the lateral aspect of our foot and create a motion forward and backward as we cross fiber over the serratus anterior. Working slowly to ensure that we don't roll over any tight or restricted areas, that we give the muscle time to respond, and making sure that you are aware of any of the bony landmarks.
Okay, so in the description it showed that this is supposed to be deep tissue. I'm sorry, but deep tissue is, to me, getting more into specific work where you're trying to work out specific knots thoroughly or the muscle tension as a whole. But if you find a knot, you're gonna get into those knots. Well, when she's showing working her feet, it doesn't really look like you can do that. Also, I don't know who in their right mind thinks this position is okay, but if you're not super careful, it looks like you could accidentally step on someone and break their ribs or something. So, in this position, it's only gonna be light with your feet. It's not gonna be deep pressure. It's not gonna feel probably even medium pressure. It's only gonna be light only. So let's go somewhere else and show a better technique. As you can see, she's going super slow and she's going the length of the spine. But again, she's just really doing deep pressure. She's not getting in there and doing specific work. It looks relaxing. So and the other thing I noticed is the bars, you can't really fluctuate the length of the bars. What if you need to lower the table and lower the bars for some reason? You have no way to really lower the bars. There's only 2 holes. So there would be modifications where it's I would have bars all the way on the side on both sides, so you could hold on a better way that way maybe too. I don't know, it's just an idea because it looks kind of unstable. But here she is, she's not massaging with both feet at the same time. She's working with one foot or the other. So let's go, and maybe I can try to find contraindications. Here we go. So Ashiatsu not suitable for everyone due to the comprehensive nature of Ashiatsu barefoot massage. Therapists must take extra precaution with certain client conditions. Below is just a handful of conditions that would be contraindicated for receiving an Ashiatsu treatment. However, certified deep feet therapists will have full knowledge of all the contraindications for Ashiatsu and how to best address their needs. So, avoid Ashiatsu on the following: pregnancy, high blood pressure, recent injuries and surgeries, contagious skin disorders. Because if you touch with your feet, then you will get that contagious skin disorder. So that would be like, oh gosh, what is that? That foot fungus. I forget what it's called. Anyways, compromised immune system, acute liver or kidney disorders, certain medications, acute autoimmune disorders, recent surgical implants, and advanced diabetes. So it says use with caution on the following: controlled high or low blood pressure, diabetes type 1 and 2, because you could have a broken skin area with diabetes, previous shoulder injuries, because if you put too much pressure on the shoulder, then you're going to cause your client to be in pain, not alleviate the muscle tension or mobilize the shoulder. Acute tendinitis, arthritic joints, chronic fibromyalgia, MS, lupus, Lyme's, anxiety, PTSD, claustrophobia, lordosis, kyphosis, scoliosis, which is a wrong curvature of the spine. So it's saying use with caution because you have to follow the spine with your foot. Active hernia, advanced diabetes, recti, hypermobile, limited range of motion. So, but again, this is more broad strokes, and you don't do specific work. Did show in the video using their heel, but that's really a broad specific tool. It's not going to get in the nooks and crannies if you have like a small knot. So that's where using your hands is, and your knuckles and your elbows is going to be more thorough. So do you want a broad, deep pressure massage? That is not deep tissue. If you want specific work done, then you need to get deep tissue, which is getting the bottom layers of the muscles and what's it called? Figuring all that out. So where are there specific knots? And knots come in different forms. So they can be ropey, they can sound crunchy. You can really feel like a hard knot. Sometimes the whole muscle can feel like a solid wall, or you get a certain portion of the muscle feel really tight. So what do you want to do? So that's up to you. What is important to you when getting a massage? Are you more there for relaxation and broad strokes are important to you? Is deep pressure the most important thing? Then probably you should get a shiatsu, as long as you don't have any of these conditions. So it took about an hour, a little over an hour. Unfortunately, it took like 4 to 5 times to pass the quiz, so I failed it. The information wasn't relative for if I work at a spa or I work for myself. You can't just implement these things into your own massage or practice. You need to be taught face to face to learn them. And some of the things you shouldn't probably learn at all, because the sideline position, it's like you're fighting against gravity. The whole point of working with your feet is to be able to apply more pressure, especially to the clients that are like, I really want like deep pressure massage. So the whole point is to work with your feet and go deeper, not lighter. So I don't know why she put the person into a sideline position in the first place, because it's gonna be light pressure. So, and then they did go into more helping you understand how to wash your feet and take care of your feet better and stuff like that. Make sure they're clean and wipe them with a towel before the client. But it's like, when I was looking at the video, I was like, the floor looked like there was carpet on it. So it's like, you really probably should do like some kind of linoleum or slate, or I don't know, some kind of like floor that you can use like a quick mopper thing after each client to disinfect the floor. So you can go from the floor to the table, the floor to the table after each client. And that way you're not doing any cross-contamination. And in this video, there was like, she wore pants, and because she was standing completely on the person, I didn't see any like her like knocking the person with her pants clothing or anything. So in this position, it's completely fine to wear pants. But in the end, because to me they showed a very unsafe way of massaging with your feet by putting your client in a sideline position, and it looked like you could really step really hard on the ribs on the side, I give this video an F. So yeah, sorry about that. Like, it seemed promising in the beginning because they talked about like a compromised immune system. So, and I was like, good, yay, someone who like is like compromised immune system can be a major problem for receiving a massage. Yay, that's awesome. You can apply that to different massage modalities. But here we are. They did something else in the video that I didn't approve of, because New York State is strict. Like, you have to make sure you're going to treat your clients with safety and not hurt them in any way. Otherwise, they will sue. And that's why in New York State, there's a 1,000-hour requirement to become a licensed massage therapist. So I don't know what exactly they're doing in the sideline position. But again, if you are on the moon or something and you don't have to fight against gravity, then feel free to get a massage in the sideline position. But it's like, here on Earth, we have gravity and it's hardcore, and you can't just massage people in every position and everything be 100% safe. You have to tweak things because there is gravity. So again, hope you enjoyed this video. So let's see, what does it say about Ruth Hardy? So she is the founder of Deep Foot Bar Therapy and created the first nationally approved course for Western barefoot effleurage technique using bars on the ceiling. Learn more about Deep Foot Bar Therapy and view the e-learning courses and the workshop calendar, www.deepfeet.com. So feel free to look her up and see if you want to take her course or whatever. I don't know where she is, so have fun. And here's proof of my certificate. So I got 1 hour. So I was happy that it did took like a little bit over an hour. But yeah, I took this class on May 24. So sorry it took too long to do the review, and everything wasn't fresh in my mind. Until next time, if you have any massage related questions, feel free to put them in the comment section below. And feel free to like and subscribe to this channel if you want. Until next time.